As we grow older, staying active becomes one of the most powerful tools to maintain independence, strength, and mental sharpness. Yet the way we exercise must evolve alongside our bodies. What once felt like a beneficial workout in our 40s or 50s can now become a silent threat to our joints, spine, and cardiovascular system in our 60s, 70s, or 80s. Many seniors, eager to maintain their health, turn to exercises they believe are universally good, like sit-ups, long treadmill runs, or heavy weight lifting. But physical therapists are sounding the alarm. These common movements can be dangerously counterproductive, and in some cases, they're accelerating the aging process and increasing the risk of injury, falls, and chronic pain. The problem is that seniors aren't always told which exercises to avoid or why their bodies are no longer suited for the routines they followed decades ago. There's often a well-intentioned desire to keep pushing through discomfort in the name of discipline or to feel the burn. But what used to be a sign of progress is now a red flag. At the top of the list of forbidden exercises is the traditional crunch or sit-up. While it's long been hailed as the gold standard for core strength, the truth is that this motion places enormous pressure on the lower back and cervical spine, areas already vulnerable to degenerative disc disease and spinal stenosis in seniors. Physical therapists report a high number of seniors suffering from worsened back pain, pinched nerves, or even herniated discs from these seemingly harmless floor exercises. Even worse, the movement doesn't train the core in the way older bodies need. It neglects the stabilizing muscles that protect posture and balance. Another sneaky danger is deep squats or lunges, especially when performed with poor form or added weights. While lower body strength is absolutely vital for preventing falls, these exercises can overload the knees and hips when joint cartilage is already thinning or when osteoarthritis is present, which is common in adults over 60. Seniors often attempt squats believing they're helping their knees when, in fact, they're causing tiny micro tears and inflammation that may take days or weeks to subside, if at all. One incorrect rep on a compromised joint is all it takes to trigger a cascade of pain that can limit mobility for months. Also high on the forbidden list is running on hard surfaces like pavement or concrete. It might sound noble to take daily jogs around the neighborhood, but the constant pounding sends shock waves through the ankles, knees, hips, and spine, accelerating joint wear and leading to stress fractures, tendinitis, or bursitis. Many seniors mistake endurance for resilience, but what their body truly needs is low-impact, joint-friendly cardio that stimulates the heart without grinding away at their skeletal system. Physical therapists also warn about overhead shoulder presses and lat pull-downs behind the neck. These gym staples require a range of shoulder mobility that many seniors no longer possess due to natural age-related tightness or conditions like frozen shoulder or rotator cuff degeneration. Pushing the arms overhead under load or pulling bars behind the neck can tear weakened tendons or pinch nerves, leading to long-term disability and reduced function in basic activities like lifting groceries or reaching a cupboard. And then there are the seated leg extensions on gym machines. These appear safe, but isolate the knee joint in a way that amplifies shearing forces across the patella and destabilizes ligaments. For seniors already dealing with weakened connective tissue, this can silently worsen knee pain, especially when paired with arthritis or ligament laxity. Let's not forget burpees and jumping jacks, often promoted in fitness videos as full-body workouts. Yet these ballistic movements are often too jarring for aging joints and can compromise spinal alignment, strain the heart, and increase fall risk. Seniors following along with energetic online instructors may feel pressure to keep up, but the cost could be a pulled muscle, twisted knee, or a sudden spike in blood pressure that their body can't quickly recover from. All of these examples reveal one core truth. Just because an exercise is popular or once felt effective doesn't mean it's right for you now. As the body ages, cartilage thins, bones become more brittle, muscles lose elasticity, and reflexes slow down. The nervous system becomes less responsive to impact, making it harder to recover from a misstep or catch a fall. The heart may not handle sudden bursts of activity as well. Yet with the right information, seniors can still move powerfully, stay fit, and prevent decline, just not with the same routines designed for much younger bodies. Instead of pushing through pain or mimicking the workouts of their youth, seniors need to listen to the red flags and recognize that their exercise needs have shifted in a major way. This is not about stopping movement. Far from it. It's about moving smarter, not harder. Movement should feel empowering, not exhausting or painful. In the following sections, we'll uncover what physical therapists actually recommend as safer alternatives that protect joints, enhance mobility, build real strength, and support long-term independence. But first, it's crucial to internalize this message. If you're over 60 and still doing these forbidden exercises, it's time to stop. Not out of fear, but out of wisdom and love for your body. You've earned the right to move in a way that respects your joints, honors your age, and sets you up for vitality, not injury. Understanding the dangers behind these forbidden exercises begins with acknowledging a fundamental truth about aging. Your body is no longer operating with the same structural integrity, hormonal balance, and tissue resilience it had in your younger years, and attempting to push it through inappropriate movements is not only counterproductive, it can be devastating. One of the most overlooked dangers comes from exercises that appear harmless on the surface, such as toe touches or forward folds where the spine is flexed while the hamstrings are aggressively stretched. Many seniors think these are good for loosening up, but they actually place undue stress on a lumbar spine and increase the risk of vertebral compression fractures, particularly in individuals with undiagnosed osteoporosis. The reality is that many seniors are walking around with thinning bones without realizing it, and a simple bend forward done repetitively can lead to long-term vertebral damage. Similarly, exercises like bicycle crunches, Russian twists, or any core movement that involves a twisting motion at the waist can place the spine under rotational stress that its age discs are no longer designed to tolerate. These rotational forces can worsen conditions like degenerative disc disease, spinal arthritis, and sciatica, often causing flare-ups that leave seniors immobile for days. Even movements done in group settings like yoga or Pilates classes, while seemingly gentle, can become harmful if they include poses that hyperextend the spine, demand deep hip rotation, or force pressure into the wrists and knees. For example, downward-facing dog or plank positions, though popular, may be too intense for older adults with wrist arthritis, shoulder impingement, or weak core control. Holding these poses without proper alignment can quickly strain the rotator cuffs, impinge the bursa, and lead to sharp pain that persists long after the class ends. The situation worsens when these exercises are done in a social setting where seniors may feel embarrassed to stop or modify. Social pressure, pride, and lack of clear instruction often lead older adults to push beyond their safe limits in silence. And the cost is felt not immediately, but in the days and weeks after, as inflammation builds and pain slowly creeps in. Physical therapists also caution against popular group boot camps or circuit training programs designed for the general population. These high-intensity formats often include jumping movements, rapid transitions, and exercises like kettlebell swings, mountain climbers, or box jumps, each of which is riddled with risk for someone in their 60s or older. The issue isn't just physical wear and tear, but delayed reaction time. Seniors are slower to correct a stumble, slower to adjust form, and slower to detect when a joint is being overstressed. That split-second delay is enough to transform a poor movement into a torn ligament or ruptured tendon. What makes all of this more concerning is that many fitness programs fail to screen for joint integrity, pre-existing conditions, or cardiovascular limitations before putting seniors through routines designed for much younger bodies. And when injuries happen, they're not just painful, they're life-altering. A torn rotator cuff can mean no more reaching for shelves, no more independent dressing. A knee injury can take away stairs or walks with grandchildren. A fall can mean the loss of driving privileges or independence. It's a slippery slope, and it often begins with the wrong exercise. Physical therapists stress that what seniors need is not less movement, but smarter movement. Exercises that prioritize joint stability, slow, controlled motion, and full body awareness. This means avoiding any motion that demands explosive effort, rapid direction changes, extreme ranges of motion, or prolonged weight-bearing on compromised joints. For seniors already managing arthritis, spinal stenosis, balance issues, or cardiovascular concerns, exercise selection becomes even more critical. There's also a hidden risk in holding static stretches for too long. While flexibility is important, long-duration static holds can overstretch weakened ligaments, destabilize joints, and reduce the ability to control range of motion, especially in the hips and shoulders. Physical therapists are moving away from these in favor of dynamic, range-safe movements that train mobility within limits the body can handle. Even common gym equipment can be dangerous for seniors if not properly adjusted. Machines designed to isolate muscles, like chest press or shoulder press machines, may place the joints at mechanical disadvantages, locking them into ranges where torque becomes dangerous. For example, starting a chest press with the arms too far back can tear the pecs or strain the shoulder capsule. It's not about demonizing exercise. It's about finally giving seniors the specific knowledge they deserve so they can continue to enjoy the benefits of movement safely. Most seniors simply aren't told that the very thing they're doing in the name of health might be quietly sabotaging it. These exercises aren't forbidden because they're inherently evil. They're forbidden because they ignore the biological truth of aging. The joints aren't as lubricated. The tissues aren't as elastic. The bones aren't as dense. The muscles aren't as reactive. The balance systems aren't as sharp. And the cardiovascular system isn't as forgiving. Trying to impose a 30-year-old's workout on a 70-year-old frame is not a badge of honor. It's a recipe for decline. What's needed is a shift in mindset from quantity to quality, from intensity to intentionality, from tradition to transformation. The next section will dive into exactly what types of movement are safe, restorative, and deeply effective for seniors. Not just for exercise, but for everyday life, helping seniors live longer, move easier, and stay in control of their own bodies without the silent sabotage of outdated fitness fads. Now that we've uncovered the dangers of these commonly practiced but silently damaging exercises, it's time to shift the focus toward what movement should look like for older adults seeking strength, mobility, and longevity without compromising their joints or risking serious injury. Physical therapists across the globe agree that the most effective routines for seniors revolve around three core principles: joint protection, stability enhancement, and functional movement training. These pillars work together to restore confidence in daily activities, reduce pain, and prevent common age-related injuries that so often begin subtly and spiral into long-term disability. The best exercises for seniors are ones that emphasize slow, controlled movement with proper posture, attention to breath, and balance reinforcement. Movements that mimic real life, such as standing from a seated position, reaching for an object overhead, or safely lifting a light load off the floor. Rather than straining tendons with isolated resistance machines or overwhelming the body with fast-paced aerobic classes, seniors benefit more from bodyweight movements like wall-assisted squats, seated marches, heel raises, and gentle hip bridges. Each of these builds strength around the hips, knees, and core without the instability that plagues exercises requiring fast coordination or deep flexibility. Walking remains one of the most therapeutic forms of movement for older adults, but even this must be done with intention. Good footwear, an even walking surface, upright posture, and walking at a pace that allows for rhythmic breathing are essential. Those with joint stiffness may find immense relief from water-based activities such as aquatic aerobics or water walking, which offer resistance without strain and enable the joints to move freely without gravity grinding down on the cartilage. In fact, water therapy is one of the most underutilized forms of rehabilitation for seniors who've previously been injured by forbidden exercises. When seniors move in water, they regain trust in their body's ability to move, often finding that pain vanishes as the pressure is lifted from their knees, hips, and spine. Another powerful tool in the senior movement toolbox is the use of resistance bands, which offer progressive, customizable resistance and can be used to strengthen the rotator cuff, hips, legs, and arms while allowing the user to stop the motion at any time without the risk of dropping heavy weights. These bands, when used with guidance, can retrain weak stabilizer muscles that often go neglected by traditional strength routines. But it's not just what movements seniors perform, it's how they perform them that makes all the difference. Physical therapists often coach their older patients to engage in a practice known as movement preparation, which includes deep diaphragmatic breathing, slow joint rotations, and isometric holds to activate the muscles before any dynamic exercise. Warming up is non-negotiable in older adults because cold, stiff joints are more prone to injury. Just 5 minutes of slow wrist rolls, neck tilts, shoulder shrugs, ankle pumps, and pelvic tilts can mean the difference between a successful, energizing session and a painful one that ends in injury. The best part is that these movements aren't reserved for the gym. Seniors can build them into their daily life, stretching gently while watching TV, balancing on one foot while brushing teeth, or engaging their core while standing at the sink. Physical therapists also recommend proprioceptive exercises, movements that train the body's sense of balance and spatial awareness, such as standing on a soft surface with eyes closed or slowly walking heel to toe along a straight line. These build neuromuscular control and help prevent falls, which are the leading cause of hospitalizations and long-term decline in older populations. But perhaps the most powerful and overlooked method to protect the aging body from exercise-related harm is personalized modification. Physical therapists are adamant that no two senior bodies are the same. Some may have excellent upper body strength, but poor hip mobility. Others may have a history of back surgeries or silently progressing conditions like spinal stenosis or Parkinson's. In these cases, what is safe for one person may be hazardous for another. This is why generic group exercise classes or YouTube workouts not designed for seniors often cause more harm than good. A truly safe and effective movement plan must be designed around the individual's medical history, structural limitations, and functional goals. For example, someone with knee arthritis should avoid deep squats, but can perform sit-to-stand drills from a raised surface. Someone with shoulder impingement should avoid overhead pressing, but can do resistance band rows at waist level. Someone with balance issues may need to hold onto a sturdy surface during single leg movements or avoid fast-paced aerobic routines altogether. It's not about doing less, it's about doing what works best for your body's current abilities. In fact, when seniors transition from inappropriate exercises to those designed specifically for them, they often experience renewed energy, decreased chronic pain, better sleep, and even sharper mental focus. They begin to move with more confidence, more independence, and less fear of injury. They stop relying on canes, cut back on pain medications, and even report feeling younger and more resilient. The body, even at 70, 80, or 90, is remarkably adaptive when it is treated with respect and intelligent design. What seniors need most is to be empowered with the right knowledge, not fear-mongered, but educated on what truly supports longevity. We've spent decades telling seniors to just keep moving, but now we know better. It's not about moving more, it's about moving better. And in the next section, we'll expose some of the popular myths that have kept seniors stuck in these dangerous routines, along with the deceptive fitness advice that may look scientific on the surface, but is quietly robbing older adults of their strength, balance, and health. Despite the warnings and well-documented risks, many seniors continue to engage in forbidden exercises because of persistent myths and outdated beliefs that have been ingrained in health culture for decades. One of the most harmful misconceptions is the idea that pain equals gain, a phrase that has led countless older adults to push through discomfort in hopes of building strength, only to exacerbate joint degeneration, cause muscle tears, or trigger inflammatory responses that spiral into chronic conditions. Physical therapists have worked tirelessly to reverse this mindset by teaching seniors that pain during exercise, especially sharp, stabbing, or lingering pain, is a signal from the body that something is wrong, not something to ignore. And yet, seniors often feel pressure to keep up with younger fitness trends, to follow routines seen on television or social media influencers claiming that certain high-intensity regimens are the secret to eternal youth. But for older adults, especially those with prior surgeries, osteoporosis, arthritis, or spinal conditions, blindly following these trends can be not only ineffective but downright dangerous. Another major misconception is the belief that the only way to stay fit is to use machines in the gym, such as leg press machines, chest press benches, or seated twist machines. While these may seem safe because they are stationary, they often isolate muscles in unnatural patterns, placing excessive pressure on the spine and joints while neglecting important stabilizing muscles that prevent falls and improve posture. These machines also tend to remove the need for balance and coordination, two of the most vital functions to preserve as we age. Instead of building true functional strength, they can create imbalances that lead to joint misalignment, reduced mobility, and increased fall risk once the person returns to everyday movements like walking, standing from a chair, or reaching overhead. Moreover, the obsession with repetitive cardio routines, especially running, jumping jacks, or high-impact aerobics, has led to widespread overuse injuries among seniors trying to keep up with well-meaning but misguided advice. These activities, while potentially beneficial in youth, become harmful in aging bodies where cartilage is thinner, bones are more fragile, and recovery takes longer. Repeated jarring motions can inflame joints, irritate tendons, and even cause stress fractures, especially in the knees, hips, or lower back. This is why physical therapists strongly recommend low-impact alternatives that are just as effective for cardiovascular health, but far safer, such as elliptical walking, stationary cycling, chair-based aerobic sequences, or water aerobics. Another overlooked danger in senior fitness is the tendency to hold static stretches for prolonged periods, especially before warming up. While stretching can improve flexibility, holding a hamstring stretch for 60 seconds without prior movement can strain muscles, reduce power output, and create instability in joints that are already vulnerable. Seniors are far better served by dynamic warm-ups that prepare the body for movement, such as slow leg swings, gentle torso twists, or light marching in place. Furthermore, balance exercises must be prioritized but not rushed. Too many seniors attempt standing on one leg or walking backward without proper progression or support, leading to falls that result in hip fractures or traumatic brain injuries, two of the most life-altering events an elderly person can face. Physical therapists suggest gradual progression, such as tandem, standing with support, heel-to-toe, walking along a wall, or balance board training in a supervised setting. But perhaps the most dangerous trend of all is the lack of individualized programming. Seniors often sign up for group fitness classes or follow one-size-fits-all online videos that don't take into account their medical history, range of motion limitations, or personal goals. They push through movements that may have been designed for middle-aged adults, not realizing that their own needs are vastly different. This is why personalized assessments, either through a physical therapist, a senior-focused trainer, or even a comprehensive home evaluation, are so crucial. Identifying muscle imbalances, posture deviations, gait issues, and joint instability allows for a custom movement strategy that strengthens weak areas, mobilizes tight ones, and supports the body holistically. This proactive approach doesn't just prevent injury, it rebuilds confidence, enabling seniors to move more freely and with purpose. In fact, seniors who adopt functional, customized movement plans often report improvements in energy, digestion, sleep quality, mental clarity, and even emotional well-being. Exercise becomes not a chore, but a source of empowerment. They begin to reclaim their independence, no longer afraid of stairs, grocery bags, or minor slips. They sleep more deeply, experience fewer aches upon waking, and engage more fully in the activities they love: gardening, dancing, playing with grandchildren, or simply walking in nature. That's the transformative power of movement done right. It's about protecting the body without fear, moving with wisdom instead of ego, and learning that longevity isn't achieved by mimicking youthful trends, but by embracing the intelligent guidance that decades of research and physical therapy now provide. So if you or someone you love is over 60, remember this: the road to a strong, flexible, pain-free body does not lie in punishing workouts, dangerous positions, or outdated advice. It lies in gentle, smart, purposeful movement done consistently and with care. Physical therapists are not trying to stop seniors from exercising. They're trying to stop them from hurting themselves in the name of exercise. The good news? It's never too late to begin moving differently. Whether you're 60, 70, 80, or beyond, your body is capable of incredible healing and strength when you stop doing what's harmful and start doing what's right. And that, more than any supplement or surgery, may be the key to a longer, more vibrant life.